So some things to think about when you're considering choosing a new plan. So if you are comparing your drug plan during open enrollment, you want to make sure that the plan that you are considering covers all your medications. The last thing you want is a drug plan that when you go to the pharmacy in January or February, that one of your prescriptions isn't covered. You want to make sure your plan covers all of your medicines at the cheapest out-of-pocket cost to you. You can pick a new drug plan every single year. You want to know if there are any restrictions on any of the medications that you take. Are there quantity limits? Are pre-authorizations required for any of your medications? If you have other drug coverage, will your Medicare drug plan work with that coverage? For instance, if you have VA coverage, and VA benefits and Medicare benefits don't work together. How much will you pay? What are your premiums? What's the annual deductible? They change from year to year. The 2025 plans are not available for us to see yet. We can't see those plans until probably late next week or one day next week. After October 1st is when they will drop and we'll be able to look at 2025 plans. And so that's when we will be able to see what the premiums are for next year and what the deductibles are going to be for these drug plans. How much are you going to pay at the pharmacy? What's your copay for your medications? Or what's your co-insurance? If you take the way these drug plans work, it's a tiered system for your prescription drugs. It's a 5-tier system. Tier 1 is your preferred generics. And tier 2 are your just regular generics. And then they go up, like tier 3 is your brand name. Tier 4 is your specialty drugs. And I forgot what they call tier 5. But as the tiers progress, your share of that payment increases. For many of the preferred generic drugs, they often will have a zero copay. And then for some of the higher tiers, you have a certain percentage of co-insurance for those drugs. You want to know if your pharmacy is in the plan's network. Pharmacies can be preferred networks or they can just be regular in-network pharmacies. Some pharmacies may not be in a plan's network. And if you're in a drug plan and your pharmacy that you love to go to is not in that plan's network, you will pay retail costs for your prescriptions at that pharmacy if it's an out-of-network pharmacy. So you want to make sure that you pick a plan that you can go to the pharmacy of your choice, unless you're willing to switch pharmacies. Some people are, some people aren't. And that's okay. It's a personal preference, but you need to know if your pharmacy's in the network. Do they have a mail order? You know, most companies do have a prescription mail order plan. And what's the plan star rating? These plans have star ratings with Medicare, and those ratings are based on consumer feedback, provider feedback, pharmacy feedback. And I think they go from 1 to 5, with 1 being the lowest and 5 being the best. And I don't know that there's a 5-star plan that'll be sold in North Carolina for next year. We won't know that until those plans drop. So those are some of the questions you would need to think about before choosing a drug plan. There's also some things you need to consider if you are choosing a Medicare Advantage plan. How much are your premiums? What are your deductibles? What are your co-insurance and copay amounts? Those are important things to know with an Advantage plan. What's the annual maximum out-of-pocket cost for the plan? Excuse me, let me take a quick sip of water. What is the service area for the plan. Like what is in network and what is not in network? What are my doctors and hospitals and providers that I want to use? Are they members of this plan's network? Are there additional benefits that are not covered by original Medicare? A lot of Advantage plans, or some Advantage plans, offer what I like to call bonus benefits. These are benefits that original Medicare doesn't pay, but they're all sometimes offered as bonus benefits in an Advantage plan. Some examples of that would be some limited dental or vision coverage, or some over-the-counter grocery coverage, like a grocery card, or transportation. These plans are also star rated, just like drug plans are. Sometimes there are certain rules you have to follow to access health care, to get your services, as far as maybe if it's a closed network, you have to have a referral. Some things require referrals, some don't. So these are just some of the things that you would need to consider if you have an Advantage plan, or if you're thinking about choosing an Advantage plan. There is a tool on Medicare.gov. It's a Medicare Plan Finder tool on the Medicare.gov website. And that is the tool that we as SHIP counselors use when we are assisting folks with doing a drug plan or an Advantage plan comparison. And when we use that tool on Medicare.gov, we will be asking you questions, and we are not being nosy, but we have to provide a certain amount of information into that Plan Finder tool in order to have it give us some options for you that would work for your preferences and for the prescriptions that you're on. And you can use that tool yourself if you have a Medicare.gov account or Medicare.gov profile, or you can use the Plan Finder tool without having a Medicare.gov profile. But that is that's what we use as SHIP counselors when we are assisting Medicare beneficiaries with their plan comparisons each year.